This is the treatment of arterial air embolisms, or when you get bubbles in your arteries. This can be a complication, for instance, of cardiopulmonary bypass, which is when excess gas or air is entrained into the aortic cannula. For instance, this might happen when you have an occlusion of the gas outlet port, which then causes excess gas in the oxygenator and forces air across the pores in the oxygenation membrane and into the arterial blood, which can then go to the brain and cause a stroke, ischemic cerebral injury. To treat this condition, if you suspect it, you first want to put the patient into steep Trendelenburg positioning to divert the air embolism away from the brain. You're using the buoyancy of the air bubbles to get it away from the brain in this position. You can also do deep hypothermia, which decreases the cerebral metabolic rate, which will limit the effect of the ischemic brain injury. You can also do permissive hypercapnia, which promotes cerebral vasodilation, increasing blood flow to the brain. You also want to avoid hypotension to maximize your arterial oxygenation and cerebral perfusion. And lastly, in some cases you might want to consider retrograde cerebral perfusion.